Oh, good afternoon to you. I do hope that you're doing fine. I am fine. How have you been? Uh, yeah, I trust that you're doing well as I am by the grace of God. Now, welcome today to our first class in terms of handling our first topic, uh, which is basically introduction first aid. Um, and I will just want you to engage with me through this course. First aid, I know it's what is needed like in every place of work. Uh, it's an important aspect of every place of work, and employers or the owners of businesses should ensure first aid related matters or other first aid kits are in place. There are aspects that need to be put in place to ensure the safety of the workers. When you get to your third semester, you shall look at a unit called Occupational Health and Safety, which has much that relates to the issues to do with first aid, because workers are equipped with knowledge on first aid. They're able to help each other in case there's an accident or an emergency at the workplace. So today we want to focus on the introductory part of first aid, and basically first aid. When you talk of first aid, what comes to your mind is the aid that comes first, the first response that is done to an individual. What comes to mind, I know, is that help that is given to someone who has had an emergency, maybe an accident or something related to that. Is it? I do hope so. I do hope that is your imagination. And we'll go through this topic by looking at the definition of first aid, the role of a first aider. We shall be able to look at how we can assess situations calmly, like when you're a first aider, you don't just rush to save lives, but you also look at your safety first. And then we'll focus on the first aid situation, diagnosis and treatment in first aid situations. We shall also learn about first aid method, whereby we have to consider the airway that one is breathing. We have sometimes to do the CPR, that is the cardiopulmonary resuscitation, in case someone is not breathing, to help the people breathe. So we shall be able to explore that, and it's going to be interesting. The first aid kit is very crucial at workplaces and even in our homes, so that it has several equipment or materials that will help us in case of an emergency. And maybe that is it. Learn how we can make some arm slings and the rest. So to begin with, the objectives of this topic are that by the end of this topic, you should be able to explain what first aid is, the role of first aider, the items in first aid kit. You should also be able to describe the first aid situations, diagnosis and treatment. You should also be able to learn more about first aid and the CPR, and also assessing the level of consciousness in people who've gone unconscious, or finding out if they're conscious. And again, we shall be able to finally be able to see how we can prescribe treatments in case it's something that we can be able to work on. Now, first aid is said to be emergency treatment administered to an injured or sick person before professional medical care is available. It's the immediate medical assistance given in an emergency, or we can say it's emergency aid or treatment given to someone injured, suddenly ill, etc., before regular medical services arrive or can be reached. Have you ever been in a situation whereby maybe you're at the workplace or in a matatu, in a vehicle, or maybe on the street, and you just see someone falling down? How do people react? There are those who will rush there quickly and try to elevate their legs. Why do they do that? And you'll find that that's crowding. Or maybe remember your days in high school or primary. There are situations when you saw someone passing and what the teachers tell you? The teachers could tell me to carry the person who's fallen and take him under a shade or in an open place and then try to fun. Of course, we are not supposed to really fun. The major thing is to ensure that there's circulation of air. This is actually the major concept. So we find that people crowd, and that is wrong. People crowd around people who maybe who along the road or on the street, or in our offices. People will crowd there because they're curious. They want to know what has happened to this person. But really, it's important that people keep away at least a meter away so that they give enough room for ventilation of at least given individual who has maybe dropped down suddenly. It could be sudden illness. Maybe he or she's just feeling weak, feeling tired, feeling high aspiration. For such it's and always it's important to help this person lie down flat with the head a little high, facing upwards, and then with the legs on a higher surface. You can put some maybe like pillows or whatever it is. Improvise. Always remember we're saying this is emergency treatment. This is immediate medical assistance. You may not be a medic, but because you have the knowledge, you put some, it could be a full of, it could be a jacket. You remove it, you fold it nicely, and you put it under the feet of the person so that we have enough blood circulation towards the brain. Because usually when people pass out, usually there is less circulation because the brain. So with that, you ensure that the head is facing upwards. You lift it, you tilt from the chin slightly upwards so that the airway is open. Because when the person is bent or the head is higher towards the chest, there is no circulation of the air. Because this person will be unconscious, we need to ensure that you lift the head so that you slightly open up the airway so that the mouth is slightly. Then we start checking consciousness. That's when we shall look at it as we continue through this. So I was just trying to give you an example, like those people who put in places, children who pass out at school, what are you supposed to do? There's that first aid measure that we are supposed to give because someone has become suddenly ill or has been injured. What are you supposed to do? Usually with cut, you're supposed to apply pressure at the place where the injury is so that we stop bleeding. Then you tie with some pressure so that the bleeding is not as much. Remember, most people who die within accidents die because of shock, and shock is not shock at the someone is shocked. Shock, what we call hemorrhagic shock. Hemorrhagic shock is bleeding. Hemorrhage to bleed. So hemorrhagic shock is basically bleeding. So when you bleed a lot, it means that you're losing a lot of blood, and with that blood is going, oxygen is going out to the elements. Yeah, and the brain needs this blood, it needs this oxygen, it needs this glucose. So as it goes out, it starts to the other system towards the brain, and a person that comes to that. Yeah, so injuries, sudden illnesses, we need to know how to handle. Look at someone who's fallen maybe from a ladder, maybe someone who's on a construction, or a building is under construction, and suddenly, maybe an accident happens and he misses a step and he falls down. If he's able to survive such a person, we need to handle him with care. People always rush to help this person, even accident scenes. People rush to help these people. Why? Because they feel like you're entitled to help him. So because you don't have knowledge, you run there and everyone is like sharp, and one's holding the arm, one's holding the feet. As you hold, probably the spinal cord had an injury. So as you do that, just the injury of that person eventually make your wheelchair and save his or her life. Why? The way you handled him, because with spinal injuries, you really need a flat, firm surface. So you need to put him, you put a stretcher or something, or even a blanket or crate. As in crate, something you can carry him or her in a position rather than folding the person, especially basic medical treatment that is given as an emergency way to take care of an individual who's just suddenly fallen ill or has just been involved in a certain accident, whether at the workplace or on the road, wherever it is. Remember, accidents also, we have like the snake bites, yeah. Those are things that will need our first aid, you know. There could be machines, you know, there could be burns. Those are accidents. Now, what's the role of first aider? What is your role as you learn this unit? Because now you're going to be a first aider. What is your role? First aid is the help given to someone who is injured or ill, as you've said, to keep them safe until they can get more advanced medical treatment by seeing a doctor, professional, or go to hospital. So remember that those that if they're conscious, they're able to maybe reason out, maybe speak about their next of kin. They will be able to say maybe what the problem is, because some could be diabetic. Just when the blood sugars go low, they can easily fall and appear as if they're having fits. So with such, if you give them glucose, because they could be partially conscious and they could tell you, get me something sugary. If you give them like a Fanta or some glucose or some sugar or some biscuit, something they can easily put on and be digested, they'll be okay. So we are saying that it's that first help that you offer before they are able to get the medical help, the advanced medical treatment from doctors, other professionals that are good in those sectors. So it is you who is handling this person, but you try to find a way in which you can get this person to hospital, a way in which you can call for help, maybe for ambulance. Usually in Kenya, which number do we call? Is it 999? Maybe you'll tell me in our class when we begin. So the role of a first aider is to give someone this help while making sure that they and anyone else involved are safe. Please underline that. So your safety comes first. Much as you want to save this person, your safety comes first. Assuming there's a fire outbreak in your place of work or in your neighborhood, do you just rush in to start salvaging the property and people who are there? Assess your safety. Look at the direction of this fire. Where does it seem to have come from? Look at those people who have been able to help in salvaging the lives of those who are in Al-Shabaab attacks. With those attacks, you have to find out where is the enemy. That is why you'll find always police will take a while. They'll come, but they'll find out where are these hooligans, where are these people. So by the time they get into salvage or save the people in this place or that property, they have to really know what are we getting into. If you're somewhere, you realize that people really complain about policemen. That if they have been attacked by thieves, or they have been robbed, or they're being robbed, and they scream, help, everywhere, we are under attack. As people scream, sometimes it happens right next to the police posts or police stations. But do they get immediate help? In most cases, no. Why? Because probably these police have to assess, do these people have guns? And if they have, what other gadgets will they be having to harm us? So they have to assess the situation before they get there. They have been trained. So even as a first aid, you need to assess the situation first. Ensure that your safety and safety of anyone else who would want help is taken care of before you make the situation worse. Because you could go there and then just worsen the situation, either die or get more injured than even those going to save, or things may just turn out to be nasty. So if you think someone needs your help, these are the 7 things you need to do as a first aider. 1, you need to assess the situation. So I've already mentioned that you need to assess the situation. You don't just go there and you're there at, hey, I have to help. Yes, you are entitled to help. That is why you are a trained health worker. You're becoming a trained health worker. That is why you have the heart of humanity within you to help others. But assess what? The safety. Assess the situation quickly and calmly. So, for example, about safety, you need to ask yourself, are you or they in any danger? So, if they're in danger, what about yourself? Are you in any danger? Like those under attacks, like with gunshots and such, like especially what we've experienced with the the wars and these Al-Shabaab militias coming in our country. As the situation, if it's a fire outbreak, find out, are they in danger? Yes, they can be, but what about you? Are you also in danger? So is it safe for you to go up to them? Ask yourself that question in terms of safety. Then about the scene, ask yourself, what caused the accident or situation? So with asking yourself that question, it could be, is it because they've attacked this place? There are foreigners in this place. Or as in assess the situation, what is, how many casualties are there? Like in terms of, in case there have been injuries, and how many? Try to assess. Then what really happened? If it's a fire outbreak, what really happened? Was it an electricity fault? Was it a human error whereby someone did something funny or lit up the fire? Was it that there was a fight? Was it a plan? You need to find out. How many people are involved and how old are they? So how many people are in that given place? If it's a building, approximately how many people are there? I think you've seen that being done on our television, as in being aired when we have like those militia attacks. You'll find that you'll be told that this building hosts about this number of people and this number was able to come out, but others are still unaccounted for. It's like the way we had an emergency about floods. You find that it was being accounted for, like there's this police station that was swept away. There were this number of policemen who were there at that particular point in time. We've accounted for 5, 2, 3 are still missing. We are looking for them. Then again, they find one body of one, or one resurfaces. It's always good to know how many people. Then what do you think the main injuries could be? What could be the main injuries? Are they cuts? Are they burns? Are they gunshot wounds? What kind of situation is it? So ask yourself this question, then you can easily make also calls to help, like ambulances, they can come in so that in case that those people who will be evacuated from the place, they can easily receive help so that they don't die. Now, protect yourself and them from any danger. So always also ensure about your protection. Always protect yourself first. Never put yourself at risk. Remember, much as you want to save other lives, your life is also equally important. So protect yourself first and then never put yourself at risk. So after having assessed the situation, then I know it's not good for you to put yourself at risk. Sometimes you may do it for the sake of others. But as a first aider, always think about this. Only move them to safety if leaving them will cause them more harm. In case you've been able to evacuate those people wherever they are, you've been able to help them, move them to a place that is more safe in case wherever they are, it's safer. Rather than leaving them in a place that could cause them harm. Then if you can't make an area safe, call 999 or 112 for emergency help. Yeah, then the third aspect expected of you as a first aider is that you need to prevent infection between you and them. Wash your hands or use alcohol gel. That tells you that every time, at least have a hand sanitizer. I know right now the thing came up, this virus, that is when maybe the sanitizer really came into the mouths of people and the minds of people, and all over on the televisions, radios, all over on the posters. We have the word sanitizer almost everywhere, and the masks. So, but in first aid, that is a common thing. You always need to wash your hands. In case there's no water around you, soap and water, do what? Use alcohol gel, which is a hand sanitizer. So always have it at least in your pocket, because usually you have the small sizes that are pocket friendly. Then wear disposable gloves. You may not have gloves at that time, but it's always good, now as a health worker, it's important to be on the lookout. You can just acquire some gloves, have them nicely packed, and have them with you. If you use a bag maybe almost on a daily basis, then don't touch an open wound without gloves on. So if someone has an open wound because maybe there's a lot of bleeding, try as much as possible not to contaminate yourself with the blood from this person, because you may not know, the person could be infected with some other infections and spread through blood or body fluids. So it's important that you protect yourself. Don't breathe or sneeze over a wound or a casualty. So you could be infected with a certain illness. So don't infect this other person, because the person is injured, he or she is more vulnerable and is more at risk. So don't breathe or sneeze over that person. Another aspect expected of you is that you need to have comfort and reassurance. Always comfort and reassure. Stay calm and take charge of the situation. Get to that place when people are crowded. While people are crowded, tell them, please create some space, move backwards at least 3 steps. Let people move. Exchange. That one usually call such a person the first responder. Tell them to move aside so that you can have time with this person and the person gets enough circulation. If maybe it's a person who has fainted or through an accident or such, like, introduce yourself to them to help in their trust. Tell them, I'm so and so and I work in this organization. I am so and so and I'm a trainer stater. I'm so and so and this is where I come from. They trust you because now with this world right now we have so many people who are con men. So we don't we don't trust. We've seen people going to accident scenes. Instead of saving people, responding to their need, they steal their phones and their valuables, money and such like. So would introduce yourself, then explain what's happening, why. Let them know why you're telling them to move backwards. Let them know that this person needs enough ventilation. Let them know that this person is bleeding, so we need to apply pressure. Let people bring about their shawls, others their coats. Let people give all they have, handkerchiefs, so that you can offer first aid to this person. Then say what you are going to do before you do it. Tell them what you intend to do. Like, assuming that you want to have this, to check the consciousness and you find this person is unconscious, is not breathing. The airway is open, but then there's no breathing. So you have to help the person to breathe. You have to do the mouth-to-mouth ventilation. So let them know what you are doing so that they don't get surprised. Then assess casualty. If there's more than one casualty, help those with life-threatening conditions first. So you'll assess those casualties, assuming you are all alone and many people have been affected and injured. What we're going to do first is to check those who are in extreme conditions, those who are life-threatening conditions, those who are critical, those who are almost dying. Deal with them first. Try to salvage them first before you reach to this other. Start with the primary survey and deal with any life-threatening conditions. Then, if you dealt with this successfully, move on to the secondary survey. The sixth aspect expected of you is that you need to give first aid treatment. Here, we do prioritize, and here you are going to do what? Prioritize the most life-threatening conditions and then move on to less serious ones. Get help from others if possible, because you could find someone who was in an accident but he's able to talk, he's able to move, and he's able even to tell you, no, kuna mwingine pale, ebu huyu anaumia hapa. Even with such a person, unamwambia after you've mobilized maybe the of the situation, remember, let people offer, kama mwenye akona shawl, shati, if there's someone who can offer a shirt or a vest, let them do something so that this other person hata anaweza jifunga, ama anaweza keti. You can talk with the person. Get help from others if possible. The 7, arrange for the right kind of help. Here, you're going to call an ambulance if you think it's serious. You take or send them to hospital if it's a serious condition, but it's unlikely to get worse suddenly. Also suggest that they see their doctor if they are concerned about a less serious condition. Advise them to go home to rest, but to seek help if they feel free. Stay with them until you can leave them in the right care. Sometime back in 2014, I was doing some certain course. My coursemate came in the evening. I was doing evening classes, and she was like, I feel so down. And I asked her, why do you feel so discouraged and down? She told me, you know what? I've found myself in an accident. The vehicle that we're using bent into a ditch, and I was dozing off, and suddenly I just saw some weight of people on me, and I wondered what was happening. Then I realized that we had fallen into a ditch, and everyone was screaming and everything. So I asked her, what about you? Did you get injured? And she was like, no, I didn't. It's like I didn't get injured. They're just people who I realized had fallen on me. And I told her, have you checked out for medical treatment? And she was like, no, I just feel okay. But I advised her, please check for medical treatment, so that you can really rule out what really happened. Yes, injury, it's okay. Yes, there's an injury, yes, checked on and be treated. So you need to advise them to go home, rest, but to seek help if they feel worse. Stay with them until you can leave them in the right care. Now, situations, we've said we have to do the assessment. So about first aid situations, diagnosis and treatment, how do you go about that? First aid is as easy as ABC. There is airway, breathing, and then CPR, that is the cardiopulmonary resuscitation. ABC stands for what? Airway, breathing, CPR, that is cardiopulmonary resuscitation. So here, a first aid course will teach you to recognize an emergency and give first to the injured or ill person until an ambulance arrives. This could mean the difference between life and death. Remember, as I've said, if you go and carry someone carelessly, you're likely to make this person get worse and the person can die. So we need to learn about how to assess the airway, the resuscitation, and the breathing. So in any situation, when we want to assess the ABCs of first aid, we do the DRSABCD action plan. What does it stand for? This stands for danger. Always check the danger to you and any bystanders, and then the injured or ill person. Make sure you do not put yourself in danger when going to the assistance of the another person. Of course, that's what we've talked about. Knowing about your own safety first, taking care. Then response. You need to find out, is this person, is the person conscious? Do they respond when you talk to them? Because you need to talk out and call out, say, hey, hello, can you hear me? How are you? What's your name? Try to touch their hands or squeeze their shoulder and then call for help. With the airway, you check whether the airway of the person is clear. Is it clear? Is the person breathing? If not, if the person is responding, they're conscious and the airway is clear, assess how you can help them with any injury that is on their bodies. But if the person is not responding and they're unconscious, you need to check their airway by opening the mouth and having a look inside. If the mouth is unclear, their mouth is unclear, it's important. As in, there's some people who, when they get accidents, it could be because of talking. So there could be food in the mouth or in the throat that has stuck there. So open the mouth and check out and having a look inside. If the mouth is clear, tilt the head gently back by lifting their chin and check for breathing. If the mouth is not clear, place the person on their side, open the mouth and clear the contents. Then tilt the head back and check for breathing. Now, the content in the mouth could be food that has been stuck, or it could be vomit. The person could have vomited, and there's a lot of substances that are stuck there. So you tilt by the side so that the person doesn't choke, and you remove whatever is blocking, and then you let the person maybe check breathing, see if the person is breathing. Now, about breathing, check for breathing by looking for chest movements. Remember, I think that we are looking at the acronym what? RABCD. DRABCD. And you said D stands for danger, R stands for response, S stands for airway, and now we are on B, breathing. So with breathing, now check if the person's chest has movements, the up and down movement that shows the person is breathing. So listen by putting your ear to the mouth and nose so that you can feel the air moving out as the person breathes. Feel for breathing by putting your hand on the lower part of their chest. If the person is unconscious but breathing, turn them onto their side, carefully ensuring that you keep their head, neck, and spine in alignment. Monitor their breathing until you hand over the ambulance to the ambulance officers. Remember, when you put by the side, usually call it the resting position. You are allowing this person to rest until help will arrive so that the person can receive adequate medical care. Now, in case the person is not breathing, you've checked, there is no chest movements, you've put your ear around the mouth and the nose, there is no sign of movement of the air, then you may have to do what? The CPR. That is the last C, ABC. Now here, with the CPR stands for cardiopulmonary resuscitation. So usually in adults, those who are unconscious and not breathing, you make sure they are flat on their back and then place the heel of one hand in the center of their chest and your hand, your other hand on the top. Press down firmly and smoothly, compressing to one side of their chest depth 30 times. Give 2 breaths to get to the next breath here. Step back gently by letting their chin pinch their nostrils. Close, use the mouth, open mouth firmly over their open mouth and blow firmly into their mouth. Keep going with the 30 compressions and 2 breaths at the speed of approximately 5 repeats in 2 minutes until you hand over to the ambulance officers or another trained person under the person you are resuscitating response. This method of CPR for children under 8, and this is very simple and you can learn this CPR. Because that helps you I'll give you some links you can check through and see how best it is done. So with CPR, you do chest compressions and you have to be fast because remember you are saving life. Help is you are offering. So if you don't have a gauze wire or something, put a tape between your mouth and the mouth of that person you're trying to save, like a handkerchief. You place it on the mouth of the person and it's open. To give 2 breaths so that you press and 2 breaths within like 2 minutes, like at least 5 rounds of it. And it tells you that you have to be really quick to salvage the life of the person. So where learn about CPR, mostly we have those organizations that offer these like AMBEF, Red Cross, and even St. John's Ambulance. They do offer these courses. You can enroll for such at your own time. About infection control and performing, I've already mentioned, at least have a mask. But remember now that this is an emergency because of the fluid that are coming from the person's mouth. Assuming the person had a fall or has been in an accident and is bleeding, the blood is coming through the mouth, there's a lot of saliva. You have to find a way to form a barrier between you and the person so that you don't contaminate yourself. So you need to have a resuscitation mask within your first aid kit or something. This helps take the worry of infection out of helping someone in a life-threatening situation. And these masks are available from first aid providers or from the pharmacy. You can get them and just have them with you. How do we assess the level of consciousness? Of course, we talked about you calling out this person to know the alertness of the person. Is the person able really to respond? Can he remember what really happened? Or even if they can't remember, can they like say their name, such like. So when we are assessing the level of consciousness, what you call the AVPU scale that has 4 possible outcomes for coding, as opposed to the 13 possible outcomes on the Glasgow scale. The assessor should always work from best, that is A, to worst, that is U. So AVPU is a scale actually. So maybe you can read further about that as we continue in our next class. It's a scale in which we shall also break down in a few minutes. So we need to, the assessor should always work from the best, that is A, to worst, which is U, and avoid unnecessary tests on patients who are clearly conscious, because again, you can find yourself taking care of patients. Remember we said when you are in an emergency setup, you always check for those who are in threatening condition. You attend to them first before attending to those who are have less serious injuries. So with this, when you want to assess that level of consciousness, you'll have to use the AVP scale, which is quite good, and it just has those 4 aspects in its scale. And A stands for what? Alert. V stands for voice. P stands for pain, and U stands for unresponsive. That's why we said we're moving from the best to the worst. So the best being alert, the person is able to see, the person could be able to speak, the person could be able to move, make movements, the person could be able to at least, you can tell that this person is breathing. And response if the person cannot talk, the person is actually unconscious. The person cannot open the eyes and see, yeah. Now, the possible recordable outcomes are usually alert. And alert, here the patient is fully awake. Although not necessarily orientated, this patient will have spontaneously open eyes, will respond to voice, although may be confused, and will have bodily or motor action. And find them, if you tell them, kunja mkono, fold your hand, they can hold their palms. Songesha mguu, they may not do much. But at least they're alert. Voice, the patient makes some kind of response when you talk to them. It could be in any of 3 component measures of eyes, voice, or motor. As in, it could be the patient's eyes open or being asked, "Are you okay?" The response could be as little as a grunt, moan, or slight move of a limb prompted by the voice of the rescuer. Yeah, okay, pain here. And now that takes us to our third assessment, pain. The patient makes a response to any of 3 component measures or the application of stimulus, such as central pain stimulus like a sternal rub, or a peripheral stimulus such as squeezing of the fingers. A patient with some level of consciousness, is a really conscious patient, will not require a pain stimulus, may respond by using their voice, moving their eyes, or moving part of their body, including abnormal posturing. Like, you need to find out this person is able to respond. Is the nervous system still okay? Are the nerves still okay, or have they been injured? So you can apply some pressure or pain, like at the tip of the fingers. You can squeeze a bit. You can feel the person saying, uchungu, or you just see the reaction, the frowning, an indication of pain. And if it's unresponsive, sometimes it's unconscious, as I've said, and this outcome is recorded if the patient does not give any eye, voice, or motor response to voice or pain. So in first aid, usually an AVP score of anything less than A is often considered an indication to get further help, as the patient is likely to be in need of more definitive care. In the hospital or long-term healthcare facilities, caregivers may consider an AVP for less than A to be the patient's normal baseline. Now, you may not carry your first aid kit all over, but it's expected that we do have first aid kits, especially first aiders. Of course, ambulances do have first aid kits, but in our hospital facilities, we do have them. We expect them to be in our workplaces, and even in our homes. So first aid kit, usually, after you've known the techniques, usually it has several equipment that will help you provide first aid. And usually in a first aid box, we usually have gauze pads. We have 2 large gauze pads, like 8 by 10 inches. We have the normal ones, 4 by 4 inches. We have the box adhesive bandages. We have 1 package of gauze roller bandage, about 2 inches wide, 2 triangle bandages, wound cleaning agents such as sealed moist towels or towelettes, scissors, at least 1 blanket, tweezers, adhesive tape, latex gloves, resuscitation equipment. We do have whereby we have resuscitation bag, airway or pocket mask. We do have 2 elastic wraps. We have splint, and also directions for requesting emergency assistance. Now, how do we reduce the risk of infection during first aid? We've already mentioned, I think in a nutshell, you could tell me as we engage in our live class. I already mentioned about the hand washing, the use of protective masks as you do the ventilation and such like, and also seeking medical help. You will learn from the other sources that I'll place in the URL, like your references, whereby you find out how you can use bandages during first aid in terms of the injury, because every injury has a way in which it has to be taken care of. Like if someone has a broken arm, you know how to make arm sling. You can still make it locally. but you can still use what is available in the first aid kit. But some people may not have the first aid kit with you, so always do that. And actually, where do you get help? So in an emergency, always call emergency lines available in your country. I hope you know the one in our country, Kenya. Your doctor, you call a doctor, an emergency department of the nearest hospital, and also an ambulance. So remember that CPR is life-saving skill that everyone should learn, and always keep a range of first aid kits handy at home, in the car, and also at work. Some knowledge of basic first aid could mean the difference between life and death, and consider doing a first aid course as I've advised you. So in first aid, sometimes there's shock and also loss of consciousness. So we talked about how to check for consciousness, and we've said you'll use what? AVPU. About shock, remember shock can be caused by anything that reduces the flow of blood, including heart problems such as heart attack or heart failure, severe internal bleeding or external bleeding, loss of body fluids from dehydration, diarrhea, vomiting, or burns, severe allergic reactions, and severe infection. And what to look for in shock, actually the appearance of the face, that is color, cold, or clammy skin, partial breathing, burst, or weak pulse, tuning or sighing, confusion, loss of consciousness in extreme cases. So what do you need to do in terms of shock? You just do the same. Help this person lie down, head low, the legs raised high, and then call out for help. Also loosen any tight clothing around the chest, waist. That means you'll have to maybe just slightly open up the belt of this person. You don't really have to open and zip the person if it's a male. Just at least loosen the clothing. Yeah. Neck, chest, and waist. Make sure it doesn't constrict the blood flow, and then keep checking for breathing and pulse and level of response, even as you put this person in recovery position or as you keep doing the CPR until the checkout. Also, find out about the first aid guide. There have been there, but of course, we've just talked about many others. We have other areas of evidence like drowsing, getting drowning, and people can get drowsy or people can collapse and faint and be in coma. So we need to just check out and be informed so that you can be able to offer necessary help when it arises. So that is it for this day. For us in this unit, I hope that you've learned something. Let me see you in the next topic. Thank you.